Is there any other unmet needs that you haven't seen advances on that you'd like to see advances on, John, in the years to come?
Well, I think undoubtedly the poorly differentiated neuroendocrine carcinomas are the highest area of unmet need. I mean, we still have the same platinum etoposide that's been used for the last 3 or 4 decades, and as of yet, no second-line therapy. So I would say, and as we just discussed, immunotherapy has been a little bit of a disappointment so far. There may be some other data coming out of Asia in this meeting suggesting a higher response rate, but I think those patients may have been perhaps more selected as far as PD-L1 positivity, and maybe it's just a different population that's being evaluated there. But yeah, in my opinion, that's by far the greatest area of need.
I would agree. I think the poorly differentiated neuroendocrine carcinomas are definitely where we have gaps and where we need to do, that patient group really needs new effective treatments. In terms of immunotherapy, maybe I'm a bit more of a glass half full person, but I still see potential. I think I'm excited to see, as we're understanding the inflammatory milieu of neuroendocrine tumors, that potentially there's a way forward there. So this has been great, John. I think this has been incredibly informative. Before we end this discussion, I just wanted to know if there's anything specific else that we haven't mentioned that you think is important to our audience when we're discussing neuroendocrine tumors.
I think we've covered all the important topics. I think we've emphasized the importance of multidisciplinary care, the fact that there's an expanding number of treatments. This is really a disease, I think, that where patients benefit from being treated in centers that treat large number of patients and have access to different treatments that may not be available in the community. And so I think that would be the take-home message from this dialogue.
I agree, and I think one of the things that I think is really important to emphasize is that basically the heterogeneity of neuroendocrine tumors and the importance of really trying to understand the different characteristics that define each individual patient's neuroendocrine tumors, and really treating each patient as an individual, and understanding that no two neuroendocrine tumors may be quite alike, and we have to sort of tailor our treatment accordingly to get the results that we want. So John, thank you very much for all your contributions, and this has been an excellent discussion. So on behalf of John and myself, we thank the audience for joining us, and we hope you found this OncoLive peer exchange to be useful and informative.